I'd say that the University of Minnesota, having been a triple gopher for undergrad, med school, and then also fellowship, it presents one of the strongest sort of academic foundations that I've experienced in my life. This program is both in med school and fellowship is so focused on education, and there's so much structure in the curriculum that you don't sort of miss out on educational opportunities when they arise. I was looking for a few things in a program. One was, because it's a very short 1 year, I was looking for the best educational experience I could find, as well as a really robust procedural experience that I could take into whatever practice I had, either academic or private, whichever I end up choosing.
What's unique about this program is that, there's so many sites that we rotate through as a PM&R resident. So you get to go through the VA, Regents Hospital, the University's Hospital, as well as like specialized pediatric training as well within Gillette. So you get to see so many different types of patients. You get to learn from so many different types of people as well.
Officially, our two main practice sites are the Veterans Affairs Hospital in Minneapolis, which is the best VA hospital in the country, as well as the University of Minnesota. But with the University of Minnesota, we have the University of Minnesota Medical Center, as well as multiple satellite clinics that operate more like a private practice.
Another benefit would be that since we work so closely with attending, it's usually just one resident, one attending, or even more. Learning from so many people just adds to your learning experience. So many of the attendings just give so much time in terms of like teaching or making sure that you have the basis to be a good physiatrist.
The faculty is super engaged with us. They show up to all of our lectures and they all participate, whether they're asking us questions with the expectation that we get things wrong and then learn from them in a sort of very positive sense.
So another benefit of the program is that they're very open to ideas from residents. So we do have like the muscle program, which is a new ultrasound program led by residents every Wednesday morning. So we're teaching each other about the ultrasound, developing your own curriculum. So whatever ideas you have, the program's open to hearing more about it and making it an achievable goal.
And the third thing is that we're given the autonomy to develop our own individual practice patterns within the framework of evidence-based medicine. So you'll see attendings show you their way of doing things, but if you've already developed a way that really works for you and is known to be safe and valid, they'll sort of let you do that within a sort of a safe framework and develop what works for you.
So there are so many research opportunities at the University of Minnesota, and depending on what your interests are, even if it's in your first year, you can reach out to people, reach out to your mentors. So whichever phase of your training, whenever you feel like that you have an interest in pursuing research, there's always opportunities, and it doesn't matter at any stage of your training.
We have a robust faculty mentorship program, which, of course, on the professional side helps support us. But I think one of the strengths of our program as far as support goes is that anytime we need something personally, the clinics are set up in a way that the fellows aren't a mandatory part of care, which helps us in that we're focused on education. We take on all the patients when we're there, but if there's any family emergency or any particular personal need, it's almost a no questions asked policy of being able to go take care of the things that you need to in your life.
Yeah, I think I couldn't have asked for better co-residents, to be honest. I think that makes a big difference in terms of the program culture. Having someone that you can relate to, you can joke, you can think about, comparing your experiences and trying to help each other grow. That's very important. Also have a good time, outside the hospital. I think that's very important, and that's what makes, I think, the University of Minnesota unique. I think we all have the same temperament, but yeah, we have different personalities, but I think we all complement each other in a way.